In this episode, we talk about topical finasteride and how I use it in my practice and where I see it fits in. So stick around and we'll talk about that.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome back to the Hair Loss Show. In today's episode we're going to talk through topical finasteride again, and I've been asked this question by an individual that watches this channel. Thank you very much. But he's asked this question multiple times, which is what are my thoughts on topical finasteride? How effective have I seen the results in our practice? And just a quick bit of background, finasteride blocks the 5-alpha reductase enzyme pathway, lowers the levels of DHT in the system, and we've done a variety of different videos on that. Topical finasteride, where I use it is I generally don't, for most people, don't use it as an initial therapy for a number of different reasons. One, I find that it's a lot easier to control if you can have it as a tablet form, because topicals only work where you apply it. So if you've got sort of generalized thinning, then it's a larger surface area where you want the actual medication to be effective. And secondly is the cost. All right, so topical finasteride needs to be compounded from a compounding pharmacy, so it's a lot more expensive than finasteride, which has come off patent, and therefore there are a variety of generics that are available and is relatively inexpensive. So in my practice, what I generally do is I start people on oral finasteride and try and titrate the dose to that individual. If I get to the point where they're getting side effects, I've dropped the dose, and I'm still getting side effects and not able to tolerate any form of oral 5-alpha reductase inhibition, and that's very rare, mind you. Normally we can try and find that balance point, but if they can't tolerate any of that, then I will introduce topical finasteride into the mix to see if that is better, because sometimes the change in formulation can be useful. And again, we're trying to stabilize this condition. So as part of my practice, it already is a small proportion, because I will try my best to find a dose for a patient to tolerate as an oral format. The other thing to remember is that with topical finasteride, it doesn't act locally that we're aware of. All right, it's not that applying it to the scalp, it absorbs and works on the hair follicle. No, it has to absorb through the skin, and then it's transported into the system. It's absorbed systemically, transported to the liver, where it's metabolized into the more active form, and then goes back to the hair follicle to lower that level of DHT. So I don't believe that topical finasteride is the panacea. All right, I think it has a role to play. It can be useful. I've had patients that are unable to tolerate oral finasteride that we've been successfully managed to switch to a topical version and have provided some form of stability. And that's probably not as monotherapy, potentially adding minoxidil into the mix as well, and other things like low-level laser or PRP or Regenera. So use a combination of therapies at that point. But there's no big studies of topical finasteride in comparison with oral finasteride, but I can only give you what my experience is in our patient group and how we found topical finasteride to be useful in certain parts, but not as a general rule. So I hope you find that useful. To the person who keeps asking that question, I hope that answers that question specifically for you, but everyone else, I hope that gives you enough clarity as well. Thanks again for watching, and we'll see you on the next episode. Take care.